Gout is a chronic disease, and that's what a lot of these patients don't understand, and that's why they don't get appropriate treatment. So when I identify a patient with gout, the first thing I do is educate them on the fact that this is not a disease that comes and goes. Even though the symptoms might be episodic, the symptoms might come and go, but the disease stays with them. It's a chronic disease. Once they have it for life, and they need long-term treatment. So the criteria for treatment is after their second attack, they need lifelong urate lowering treatment. And this is where a lot of patients don't receive appropriate treatment because they're not educated on the need to continue medicine for life. And without chronic treatment, they can have permanent joint damage. So they can get damaged erosions in their feet. They can get permanent deformities of their hands. Untreated, an acute attack might be gone in 1 to 2 weeks. So it's self-resolving. That's why a lot of these patients are under the radar, so to speak. They're not really adequately treated. They might just treat it at home with cherry juice and anti-inflammatory. Whereas if they go in, they get educated on the full course of this disease. It's not an insignificant problem. It can't just be treated it can't just treat attacks. You have to treat the underlying disease long-term. Otherwise, it develops into an irreversible problem. So they need to be on urate lowering for life to bring the uric acid under 6.0 mg per deciliter and prevent chronic recurrent attacks, because there's significant morbidity associated with attacks, not to mention the pain, the lost productivity, and the permanent joint damage. They might go to the ER or the urgent care and they might get steroids. And steroids work the best for acute attack, but steroids repeatedly over time have immense side effects. And these include obesity, diabetes, cataracts, glaucoma, infection risk, skin fragility, osteoporosis. The list goes on and on. So I've seen patients with gout who have received recurrent steroids and they have osteoporosis, for example, from recurrent prednisone. They might develop diabetes because of prednisone. So prednisone over years for the treatment of gout is very poor treatment. The treatment of gout is divided into two parts. You treat the acute attack and you treat the chronic disease. So the acute attack, there's basically 3 treatments. There's steroids. You can give steroid pills, steroid sub-Q, or steroid intra-articular. You can give colchicine pills, or you can give NSAIDs if they have functioning kidneys, such as Advil or Motrin or Aleve. So that you treat the acute attack, because that's why the acute attack is why a patient comes to you. They're in pain. They've missed work. They can't walk. And then as a physician, that you want to treat the underlying process. You have to educate them that yes, this attack will go away, probably go away in 5 days or so, but you still need long-term treatment. Otherwise, you're going to develop another attack and another attack. And the natural course of gout is after the first attack, they develop a second one. And then the interval between gout attacks shortens. So that's called the intercritical period. So that the symptom-free period shortens. And initially, they usually have 1 joint affected at a time. And then over time, they might get 2, 3, 4, 5, half a dozen joints affected at the same time. And then pretty soon they don't have an intercritical period. They're in chronic pain. So then they have chronic gout. And then they might develop tophi, which are visible lumps, usually on their elbows or their Achilles tendons or their toes. And then they have tophi that are deeper in the structure of the body that the physician or the patient can't see, but are found by special scans such as the PET-CT. So as a physician looking out for my patients, the best treatment is to start them on lifelong urate lowering treatment. Pills that they take every day to lower the uric acid. And gout is a simple disease to treat because you check the blood serum uric acid, and if the goal is to get it under 6.0 mg per deciliter, because that is the ACR guidelines for adequate treatment of gout. So the uric acid is checked, and I tell the patients this because it's very easy. They want to know what their uric acid is. They know that 6.0 is the magic number. And if they have extensive tophi, then we have to go even lower. And then there's further treatment that's just been available for approximately 10 years. It's an enzyme, and it's an IV treatment that I've given in my office since it was FDA approved almost 10 years ago now. And it's given IV, a 2-hour infusion every 2 weeks. And it is designed to lower uric acid is almost undetectable. Humans don't have uricase enzyme. So this provides uricase enzyme which converts uric acid, which is into allantoin, which is 100% renally excreted So it flushes all the uric acid out of their bodies. They might start with a uric acid of 10, for example, 10 milligrams per deciliter. And after the first dose, the uric acid might be less than 0.1. So with that equation of they're dropping the uric acid so low, it just flushes everything out of their body. Patients might take 1 dose, they might take 12 doses or even more. I've had some patients take 2 doses, some take it for a whole year, and it literally dissolves the tophi from their entire body. It's the first biologic on the market for gout. It's the enzyme, like I said, and it converts uric crystals to allantoin, which is readily excreted by the kidneys. It is highly effective in lowering uric acid to undetectable levels, whereas the other treatments might lower uric acid to only, say, 5. The IV treatment will lower it to undetectable. The benefit of getting it so low is that it resorbs the crystals that are deposited throughout their body, tophi that are both visible and non-visible, fast. Whereas the other medicines might take 100 years. You never see resorption. Whereas the IV treatment, the enzyme, lowers it so quickly and so rapidly that it essentially is like liquid Drano, just flushes the crystals out of the body. In the old days, they went to podiatry and had operations to remove the tophi. And that's hugely expensive and huge risk to the patient. They have a lot of downtime. The scalpel might hit a nerve, a tendon. They might get in post-op infection, lots of complications with an operation. Whereas this IV, like I said, it's like liquid Drano, just flushes the crystals out of their body. It's revolutionized the treatment of gout. Of course, it's got to be monitored closely and blood tests before and after. And patients are very, very happy because they thought that this was, this is what they had to live with.